Hi, I'm Art Caplan. I'm at the Division of Medical Ethics at NYU's Grossman School of Medicine. If you're watching this and you're anywhere near Seattle, Washington, anywhere near Florida, anywhere where it might be not oppressively hot outside, but encouraging of some people who might want to go out and get a little exercise, you've undoubtedly seen or heard of pickleball. Pickleball turns out to have a downside. The upside is it's got a lot of people outdoors getting some exercise, socializing, it's all to the good. But a recent study came out and said there are about $500 million worth of injuries coming into the healthcare system associated with pickleball. It turns out that there are leg sprains and broken bones and people getting hit in the eye, and on the injuries go. Hamstring pulls and many, many problems. I've been told that a lot of the spectators who show up for pickleball matches are there with a cast or have some kind of wrap on because they got injured. Well, a lot of people have argued in the past, what are we going to do about healthcare costs? And some suggest if you voluntarily incur healthcare damage, you ought to pay for that yourself. You ought to have a big copay. So if you're out there and you decide you're going to do cross country skiing or downhill skiing and you injure yourself, you chose to do it, you pay. If you're going to not maintain your weight or you're going to smoke, you're going to ride around without a helmet, that's your choice. You ought to pay. Well, I think the pickleball example is really a good challenge to these views. You obviously want people to go out and get some exercise. And here we're talking about a population that's a little older, oftentimes doesn't get out there as much as doctors would like to get the exercise that's still important that they need. And yet it does incur injuries and problems. My suggestion would be let's make the game a little safer. Let's try to encourage people to perhaps warm up more before they get out there and jump out of the car and engage in their pickleball battles. Maybe goggles might be important to prevent the eye injuries of a game that's played pretty up close. Maybe we want to make sure that people look out for one another out there. If they think they're getting dehydrated or tired, that they say, let's sit down. But I'm not willing to put a tax or a copay on the pickleball players of America. I know they choose to do it. It's got an upside and benefits, as many things like skiing and other behaviors that have some risk do. But I think we want to be encouraging of it, not discouraging of it. I don't like a society where anybody who tries to do something that takes risk winds up bearing extra cost for doing that. I understand that that gets people irritated when it gets to dangerous, hyper risky behavior like smoking and like not wearing a motorcycle helmet. But I think the way to engage is not to call out the sinner and not to try and punish those who are trying to do things that bring them enjoyment, that bring them reward, or in some of these cases, bring them physical fitness. It's to try to make things safer. It's try to gradually improve and get rid of the risk side to capture the full benefit side. Now, I'm not sure I've come up with all the best ways to make pickleball safer, but I think that's where our thinking in healthcare should go. So my view is get out there, play pickleball. If you do pull your hamstring, raise my insurance premium a little bit. I'll help to pay for it. Better you get some enjoyment, better you get some exercise. I get the downside, but come on now, folks. We ought to be, as a community, somewhat supportive of the fun and recreation that our fellow citizens engage in. I'm Art Caplan at the Division of Medical Ethics at the Grossman School of Medicine. Thanks for watching.